everyone, it's Dr. Adams. We're going to do PAILs and rails for internal hip rotation utilizing a table. So this is a regress position for those that have a difficult time getting onto the floor into the full 90-90 position. This is a nice alternative and is not as aggressive. Keep in mind as we get into the internal hip rotation, that's going to be this part of when you're doing your cars. This is internal hip rotation. So we're going to be utilizing PAILs and rails. Remember, we're contracting the musculature one way and then the other. So here's how it works. I've got a table here that's about knee height for me. So find something that works well for you as far as the height of your leg is concerned. It might be your bed, it might be a chair. If you need a little more stability on this side, you can certainly bring a chair over and kind of hang on to that. So I'm going to bring my leg up onto the table and notice how this angle created by my leg is far less aggressive than if I were on the floor, which would be more in that flat position. So here I am in internal rotation, and depending on the height of the table, I'm gonna start my stretch here. Remember, in our PAILs rails protocol, you're gonna stretch in this position for approximately 2 minutes before you start your contractions. So we're gonna leap ahead just a little bit. So if you need to pause right here and stretch for 2 minutes and then catch up with us here in just a minute, I'm gonna initiate the contraction protocol. So remember, our first contraction is gonna be gently ramped up using a 5-count system. So I'm gonna start pushing my foot as if I were turning my leg like a faucet, pushing my foot into the table with 20% of my effort. 40%, 60%, 80%, and now my maximum safest effort. So I'm really cranking my foot into the table, and I'm gonna hold that for about 10 seconds. Now remember, as this 10 seconds concludes, then I'm gonna try to peel my foot off of the table as if it were gonna move. Remember, no movement's actually gonna happen. Here I come in 3, 2, 1. I'm gonna pull up on my foot like my leg was gonna come off of the table, imagining I'm turning that faucet, and I'm immediately going 100% of my effort, and I'm holding for approximately 10 seconds. In 3, 2, 1, off tension. Remember, stay in position. That's 1 cycle. You are likely going to do anywhere between 3 and 5 cycles. Let's do 1 more cycle together, and then I'll leave it to you, okay? So I'm going to ramp up that pressure 1 more time, as if my foot were driving into the table. 20, 40, 60, 80, 100%, or my maximum safest effort, and I'm holding for 10 seconds. And I'm really squeezing here. I'm trying to focus on those internal, external rotators of the hip. You should feel that pressure right in the hip as you work with this. Remember, you might cramp in other places. In 3, 2, 1. Now I'm trying to peel my foot off the table, 100% effort. I'm really squeezing. All of this area in here is really contracting, holding for about 10 seconds. In 3, 2, 1, off pressure, and just staying into the stretch. Continue your cycles from here, and good luck.